Assalamu alaikum. Hope you all guys are fine. And today I am here with Dr. Naghman Zuberi with a new very lecture on the basic concepts of orthodontic movements. I would like to invite Dr. Naghman Zuberi. Assalamu alaikum, sir. How are you?
Walaikum assalam. I am good. Alhamdulillah. How are you?
Sir, I am also fine. Sir, you can
Alhamdulillah.
start the lecture.
Yes. Good morning, everyone. And today we will be discussing about the orthodontic tooth movement. I'm not going into the detail at the moment, just the basic concepts of orthodontic tooth movement. And if you like this biomechanics and orthodontic tooth movement and all the concepts about the mechanics in orthodontics, then we can make it a series, like maybe 4 lectures, 5 lectures on this topic, and we can continue with it. So you can always get back to the owner of this channel and let them know if you want these things in detail, so I can make like a couple of lectures on it, and it is going to help you in understanding the basic concepts as well as the advanced concepts and how to manipulate with the wires and what you have to keep in mind while uh, executing an orthodontic case and while planning an orthodontic case. So let's see. Ortho means straight and dontics are teeth. So straightening of the teeth is basically orthodontics. It is the treatment of the irregularities of the teeth, especially the alignment and occlusion. Well, even the discrepancies present not only in the teeth but in the jaws as well, upper and lower jaw, with each other as well as in reference to the base of the skull. And definitely, we utilize certain appliances to achieve this objective, that is, alignment of the teeth, alignment of the jaws, and having a proper occlusion. So basically, it is correction of the malocclusion. When we look at the nature of the orthodontic tooth movement, it has a biomechanical nature. It is solely based upon the stress strain occurs in the periodontal ligament environment. And orthodontic tooth movement results from the forces which are delivered to the teeth. Well, again, keep in mind the forces you are delivering yourself using the appliance, they are also orthodontic tooth movements. But if the off axial forces coming from some premature contact or from some ill designed appliance, they will also make the tooth move. And in terms of occlusion, we also consider those as orthodontic forces. Orthodontic tooth movement, when we are discussing about the orthodontic treatment, it requires application of forces, and periodontium should respond to those forces. Force mechanics are governed by the physical principles such as the Newton's laws. There are 3 Newton's laws, we know about those, and the Hooke's law. Forces and the biomechanical principles we discussed. So the knowledge of the mechanical principles governing forces is necessary for the control of orthodontic treatment. The proper application of biomechanics principles increases treatment efficiency through improved planning and delivery of care. As I have already mentioned, that if we are aware of what we are going to do, what is our objective to achieve, we are going to be more concerned that what kind of forces, which type of appliances we should apply in order to properly achieve that particular tooth movement. Well, first of all, keep in mind whenever you are applying the force, it has a line of action. And the tooth is going to move according to that or along that line of action. A force has a sense, means is it going in this direction, like a labiolingual direction, or the mesiodistal direction, or it is going to be apico uh, incisal direction or inciso-apical direction. Then every force has a magnitude. Though the force magnitude is measured in newtons, but in orthodontics, we measure orthodontic forces in terms of grams. And then the amount the tooth is going to travel, the distance it is going to travel, that is also predetermined. We do not want it to go farther, as farther like which is farther than the intended distance we have already planned, that okay, tooth is going to this much distance. When we plan a force, we also need to know where we are going to apply it. So it is going to have a point of application as well. Depending upon the type of appliance we have planned, like is it a removable appliance or it is a fixed appliance, we know that fixed appliance has all the kind of movements possibly we can achieve. Whereas in removable appliances, we cannot achieve so many movements, like we cannot do the torquing, we cannot do the tipping of the roots, we cannot do a lot many other. Even complete bodily movement is most of the time is not possible. As I have already told you about the three laws of movement by Newton, the first law is known as the law of inertia, the second is the law of acceleration, and the third one is the law of action and reaction. Law of inertia states that the static balance of objective, like a body, if it is in state of rest or in uniform motion in a straight line, will continue in the same state unless it is compelled to change by the forces applied to it. Like something is moving until unless brakes are applied, or maybe a resistance is there, or maybe some external force deviates it from the straight path, it will continue in the same direction. Or if something is static, until unless some force is not going to be applied, it is not going to start its movement. Law of acceleration, it states that the change in motion is proportional to the motive force that is applied. Acceleration occurs in the direction of the straight line in which the force is applied, where acceleration is force per mass. Then comes the third law of motion, the law of action and reaction. The reaction of two objects toward each other is always equal and in an opposite direction. Therefore, to every action, there is always an equal and opposite reaction. And most of our orthodontic appliances and the principle of anchorage for orthodontics, when we design an appliance, when we plan an orthodontic movement, and when we plan where we are going to get the anchorage, this is in our mind, that when we are going to move a certain tooth, the section or the segment which is moving and the other segment which is actually providing the anchorage, to some extent there will be a little bit movement in that as well. Very difficult to achieve the absolute anchorage. Absolute anchorage is only possible if you are using temporary anchorage devices, the implants, or the tooth is ankylosed. Absolute anchorage is a term which we use in those situations where there is zero loss of anchorage. Hooke's law also helps us in using these wires and bringing the teeth to their appropriate position. We deflect some wire within its elastic limit, and it tends to come back to its original position, and in that attempt, it drags the tooth along with it. Well, previously we were using stainless steel wires, and they had some limitations, but since we have now super elastic wires and temperature transitional range wires, the nickel titanium wires, so our efficiency of the arch wires, it has been improved quite a lot over the last, we can say, 25 to 30 years. Well, as we will move further, we will discuss about different types of wires which are available and what are their utilities, how they can be used. We can discuss those in detail. Just letting you know that I'm at the moment just focusing on the stainless steel wire and the Hooke's law. So if you are going to deflect it within its elastic limit, it tends to come back to its original position and will drag the tooth along with it. Well, when we are planning any type of tooth movement, we need to know about the center of resistance of that tooth. The center of resistance is along the long axis of the tooth between 1/3 and 1/2 of the root length, which is apical to the alveolar crest. This center of resistance varies with root length and the alveolar crest height. As the alveolar crest or the alveolar bone, it starts resorbing because of any reason. Could be because of trauma, because of periodontitis. So the center of resistance, it starts migrating apically. For multi-rooted teeth with healthy periodontium, the center of resistance is slightly apical. We can say 1 to 2 millimeter apical to the furcation area. Some of the authors, they say that it is at the furcation area, and other authors, they say that it is slightly apical to the furcation area. Certain factors which affect the center of resistance, like how many roots are present, as I told you, when it is a single rooted tooth, so it will be along the long axis of the tooth on the root apical to the crest of the ridge. Well, in multiple root teeth, it is going to be in the furcation area. Then degree of alveolar bone loss. I have already mentioned about that as the alveolar crest is going to be resorbed or the alveolar support is going to be lessened because of any reason, then this center of resistance, it starts moving apically. It is also dependent upon the resorption of the root as well, which could be because of any reason. It could be pathological, it could be idiopathic, it could be internal resorption, external resorption. So internal resorption has nothing to do with it, but external resorption, it definitely affects. Then comes the center of rotation. It is a point around which the body appears to rotate and is determined from initial and final position of the tooth. To understand that, the desk which is in front of you, if you are going to apply some force on one side, it is going to slightly revolve. But if you are going to push it from 2 points without changing its orientation, it will just start drifting in a way without changing its relative position. But like in terms of the x-axis and y-axis, it will just drift. So basically, you are applying a force in such a way that the resultant force or the resultant vector is passing through the center of resistance. Well, center of rotation is that point which could be present at the center of resistance. It could be apical to the center of resistance, or it could be slightly coronary to it, depending upon the intended tooth movement. We need to find out what is our intention, what kind of movement we have to achieve. Like in tipping, it is going to be at the same place where the center of resistance is. So you will apply a force and crown is going to be tipped in one direction. Reciprocally, the root is going to be tipped in another direction. Well, when we move the teeth in the extraction space, especially when we do some class 2 treatment or maybe some uh, bimaxillary protrusion cases, so it is not always possible that the tooth is going to be completely drifted or bodily translated without changing its orientation. So it will be distalized as well as it will tip us slightly. So in this case, how we can find out that what is the center of the rotation of that tooth? We will just the first position and the second position. The incisal tips, we have a straight line over here. Similarly, at the apex, the first position and the final position, we have a straight line over here. We will erect two verticals over here on these lines, and the point of intersection of those vertical, that is the center of rotation in that case. Once we are going to have a complete bodily movement, then the center of rotation will be lying at somewhere in at infinity. That is not possible to determine because it is not changing its position. So if we are going to place one line over here which will be touching the first position and the final position, and the apex first position and final position, we will erect two verticals over here. Maybe somewhere in infinity they are going to intersect each other. So we will say that in that case, the center of rotation, because there is zero rotation basically over here, virtually there is no rotation in pure translation. I have already mentioned about the tipping. Tipping is the easiest type of tooth movement. When a single force is applied to a bracket on a round wire, the tooth tips about its center of rotation. I have already shown that to you, center of rotation. And that is located almost at the center of resistance. This single force causes movement of the crown and apex in opposite direction. Keep in mind, if you are applying a labiolingual force, so if the crown is moving towards the lingual side, then the apex is going to move in the labial side. Similarly, in case of the mesiodistal movement, so if you are applying the force in such a way that tooth is going to be slightly distally tipped, its root is going to be tipped mesially. And similarly, if you are going to tip it, the crown is going to be tipped mesially, then the root is going to be tipped distally. It will be in the opposite direction. Well, tipping could be uncontrolled, as I have already mentioned in this case, and usually using the removable appliances, it is going to be uncontrolled tipping. It could be controlled tipping as well. Like we know that, okay, only we want to move the crown, we are not going to move the root. So over here, very minimal movement of the root is going to occur and maximum tipping of the crown is going to be done. We will discuss these in our subsequent lectures, how we do the controlled tipping, how we do the uncontrolled tipping. Then comes the translation or bodily movement. Translation or bodily movement occurs when all points on the tooth move an equal distance in the same direction. I have already mentioned we do not have any center of rotation. It is somewhere at infinity. The tooth starts in the same orientation from position 1, and when it reaches the position 2, its orientation is not changed in the x and y axis. Or even if you are going to mesialize a tooth or distalize a tooth, whatever you are doing, bodily movement, there is no change in its orientation. Rotation of a body is the movement of any straight line on that body by a change in the angle with respect to a fixed reference frame. If the body rotates about its center of resistance, that is called pure rotation. For pure rotation, we need to have moment firstly, but not only one moment, we need to have a coupling of the moment. Moment is a force, and which force? Which is not passing through the center of resistance, which is at a distance from the center of resistance, that is called a moment. So the amount of the force, as I told you, we calculate it in grams, and the distance of the point of application of that force from the center of resistance, that is actually gram millimeter. This is the magnitude of a moment, or we can say that that's how we calculate a moment. But when we need to do pure rotation, we need to couple those two moments. A single force cannot cause pure rotation. Only a couple can perform pure rotation. So what is the coupling of this force? Two forces with equal magnitude, they should be parallel to each other. They should have opposite sense, and they must not be collinear. If they are collinear, then what is going to happen? They are going to canceling each other's effect. To understand this phenomena, just visualize a revolving door outside some building from where a person wants to get in, the other person wants to get out. Both of them are applying the forces, and within like couple of seconds, the person who was outside is going to get in, and the person who was inside trying to get out, he's going to be out. So the same phenomena, there is a pivotal point over here, or the point of rotation, and two forces, they are applied, which would be having equal magnitude. They would be at the equal distance from the center of rotation, and they should be parallel to each other, but they should not be collinear, and they should be having equal like opposite sense. So let's just summarize whatever we have studied in this today's lecture. Like if we have different types of movements, so where the center of rotation is going to lie. Like in translation, as I already mentioned, it will be at infinity. In case of uncontrolled tipping, it will be slightly apical to the center of resistance. In case of controlled tipping of the crown, it is going to be located at the apex. And in case of root movement, which is only and only possible with the fixed appliances, then the center of rotation is going to be at the incisal edge. So over here, we will finish our today's lecture, and we are going to continue with it. If you like this idea and you want to improve your knowledge in biomechanics, so just get back to the owner of this channel, and we can start with the series, like maybe 3-4 lectures on this, and it is going to be quite helpful to all of you.
Thanks a lot, sir, for the today's lecture. It was very good. Thank you, sir. Khuda Hafiz.
Khuda Hafiz.